Good day, the listeners and also online viewers. I am Edgars Kaparkaleis, medical doctor. I am working for BK Medical as a clinical education specialist. And we are golden sponsors for this event. And thank you very much for possibility to present our company in your event. BK Medical is a Danish company. Works mostly for the surgical specialties, and of course neurosurgery is a surgery specialty. And BK Medical can provide you real-time intraoperative ultrasound that can make you the possibilities to make the decisions during the surgical surgical procedures. I think I can work with this, yeah? And of course, you get the active imaging, and also the ultrasound will provide you the possibilities to change your decisions during the procedure. Also, you can use ultrasound anytime during the procedure. On the upper image, you can see how the ultrasound was introduced in neurosurgery, and as you see, the image is very blurry. But on the lower image, this is the image of BK ultrasound for today, and this is our famous craniotomy probe. And I think the ultrasound image now is absolutely comparable, for example, with the MRI. Actually, also you can, when you do the ultrasound scans during the procedure, you never really interrupt the workflow. You can use ultrasound as much you want to, and also because if you do for example, intraoperative MRI or intraoperative CT scans, you need to interrupt the surgical workflow to move the patient in another room, and then you return him, like say, returning him back to the operating room. For ultrasound, you don't need this. Also, there you have the minimal radiation hazards to the patient. Absolutely, ultrasound doesn't have any side effects on the brain, and also our probes doesn't have the mechanical or thermal index. So this is everything was calibrated not to do any damage to the brain. Also, it's comparable, for example, the gross total resection for the high-grade gliomas. That is statistically is not big difference between the intraoperative MRI or 5-ALA. The one system is designed for absolutely all neurosurgeons. So either it's neuro-oncology, pediatrics, spine, vascular, school-based, and functional. I will little bit touch each of them. In neuro-oncology, the 16% increase of overall survival of the patients with a high-grade glioma. Maybe that percent is not that much, but this is really the focused trials for high-grade gliomas, only on focus on this. But with ultrasound, you can also treat the other tumors as well. In the pediatrics, I think the shunt placements are most important, and you reduce 23% in pediatric revision rates. Yeah, for example, you can guide your catheters on the placements, and also you can confirm those placements and not to damage any brain. In the spine, actually, yesterday was a perfect presentation from the doctor from UK, and you see the 63%. You change the course of surgery so that you reduce incision dimensions and so on. And there also you can see under the image where you can use the ultrasound in spine surgery. In a school base, you can immediately see the real time where the tumor is located is located, especially because they are really deep-seated tumors. And the important is the vascularity of these tumors, so not to damage the blood vessels and not to cause the bleedings and so on. Some doctors think that when you use the ultrasound during the procedures, that might take too long, but the studies shows that it really shortens the intraoperative time during the intraoperative when you use intraoperative ultrasound during the surgery. And also you can clear real-time visualization, for example, for electrode placements, if you do some functional treatments. And we have the digital integration with the brain lab. Actually, this is the unique feature for BK, that these two systems are communicated digitally between each other, and you can really overlay the ultrasound above the preoperative MRIs and detect, for example, the brain shift. Also, with the unique features of a brain lab, you can do the 3D reconstructions and look the real volume of the tumor. And also, with the help of the ultrasound, you can detect real tumor location. Also, the one big problem is the brain shift. You can't really predict the brain shift, but you can correct it with the ultrasound. And there are the numbers up to 11 millimeters. The brain shift is prior to opening the dura. Then you opening the dura, this goes up to 16 millimeters. And after the tumor resection, it goes almost 2 centimeters. So these are the real trials on the patients, and we did the real measurements for it. So these are the real numbers. Also, as I said about the digital navigation with the brain lab. So you can see on the left image about the preoperative MRI, and then on the right image, then there is a blue field of where the ultrasound is real ultrasound, and you can see on the red where is the preoperative tumor placement and how it is look like on ultrasound. So that's a clear brain shift. Why BK Medical? So actually we are working more than 50 years for surgical specialties, and I think we have almost every hospital have the BK systems inside the operating room, and we are just improved our systems because we invest in technologies, and these are the latest ones, and all our images are maximal optimized, that you don't need really to touch the keyboard, and to provide the optimal and high resolution image quality during the procedures. And even the remote control, what you see on the screen, is sterilizable as well. Our unique neurosurgery probes is not just the probe is fully sterilizable, but also the cables and the connectors, and you don't need to cover them. And actually it's very small footprint, and it fits inside every operating room. And of course there's also possibility to put the battery. So that was short about BK. Thank you very much.
Thank you very much, Dr. Kaparkaleis, for very impressive report. So we have a question from auditorium, but please come to the microphone.
Dr. Yuri Lankovsky, I'm impressed with your lecture, but I have some questions about the price and expensive of your machine, because our country is not very expensive, and it's impossible to have which ultrasound machine in which private clinic or in which state clinic in our country. And I have a very small, very simple question. We have in our clinic another ultrasound machine, very simple. Maybe is it possible to use our very simple machine ultrasound, but with ultrasound probe from your devices?
No, that's not possible because these probes are really dedicated for each system. I have heard that some neurosurgeons are using gynecological probes, and also there was many cases that the surgeons are saying that they totally removing the tumors, and the operation is done 100% good. But finally, the patient have some neurosurgical, neurological side effects. It might be that these not dedicated probes might be destroyed some part of the brain. So our probes are really dedicated, certified for using on the brain. So, and this is really the big. So it means. When we are producing our probes, we're also doing the trials. This is really the biggest investments on it. I also said you about that our probes are fully sterilizable. So that means those plastic parts that are on the probes can be sterilized at least 1,000 sterilization cycles. So it means that we are guaranteed as a company that these probes can be sterilized at least 1,000 times.
But we have to know about specificity of Ukrainian, and I have some experience. And in my opinion, after removing the bone flap after trepanation, sometimes in my opinion, in my experience, I used a simple linear transducer, and I had a very good quality picture.
Yeah, linear probes are high frequency probes they provide, but they are definitely not certified. This might be some kind of out of label use. So there's a different kind of might be some how it is in a like I lost the word. So if the страхование, да? The insurance, so the insurance company, so it means if it's the patients are insured, and if you cause some damages, then the insurance companies there might be different kind of approaches, can be the different kind of trials, what went wrong and so on. So, but if you are happy with this probe, then of course you can continue to use it. But I think there will be also a possibility to use our ultrasound, and then you can compare.
I'm not really happy, but I don't have the possibility to buy your device, and that's why I ask you this question, because your machine is possible to buy by only 1, 2, 3 clinic in Ukraine. It's very expensive price.
I think every good device actually is expensive. Yes. So it means you cannot buy the Porsche for the price of the bicycle. So that's why when you are buying, then you expect some quality and also additional guarantees for this. So because you also, when you're buying the expensive system, you just not get the system, you get the service for it as well.
And finally, I want to say that we in Ukraine have only one insurance company. It's named NSZU. And only
now this is the maybe it was not the correct sample, but I don't think so. I don't think so that that was so strong in Ukraine right now. But for example, in US, you can issue any person for a court, so and sometimes to win, and that's why everything should be placed correctly. Also, the neurosurgical probes, they should be the right ones.
Thank you so much.
Thank you.
impressed.
There's my colleague. She will.
Of course, one more question.
Yes, thank you. So my name is Gia Dixit. I'm from BK Medical as well. So I would like to give you information about this not label use of ultrasound, because if you want to use ultrasound directly on the brain, it should be registered as class 3 equipment, right? So only BK, as I know for today, they have this specific registration. And there is also some European directives which says that you cannot use this simple ultrasound on brain. So yeah, if you want more information, then I can find this directive and give to you, and you can just read what it is. Thank you.
Thank you for your help, and thank you for the questions and for listening. Thank you.